If you are over 70 years old and your doctor just celebrated getting your blood pressure down to 120/80, you need to hear this right now. A massive study published in the Journal of the American Medical Association tracked 15,000 seniors for 5 full years. What they found completely contradicts everything we have been told about blood pressure targets. The seniors with textbook perfect blood pressure actually had a 28% higher risk of experiencing serious falls. Even more shocking, their mortality rates were actually worse than the seniors who walked around with moderately higher numbers. Please remember, this video is for educational purposes only and is not medical advice. Always talk to your doctor before changing any medications. In the next few minutes, I am going to reveal the exact blood pressure range that science shows is associated with the longest survival in older adults. I will explain why the standard target might actually be dangerous for you after age 75. Before we dive into the medical truth, I need a quick favor. Drop a comment right now with just your age. Just your age and nothing else. I want to see who is watching, because the information I am about to share applies very differently depending on whether you are 65, 75, or 85. Also, if you have ever felt dizzy when standing up from a chair, add the word dizzy to your comment. This is critical information. Let me paint a picture of what is happening in doctors' offices across the country every single day. Imagine a 78-year-old patient comes in for a routine checkup. The blood pressure machine reads 145/86. The doctor looks at the standard guidelines on the computer screen, sees that target of less than 130, and immediately reaches for the prescription pad. Medications get added. Over the next 6 months, that blood pressure comes down beautifully to 124/78. The doctor is pleased. The patient gets a gold star. Everyone thinks this is a massive success story, but here is the dark side that standard guidelines simply do not account for. That exact same 78-year-old patient wakes up at 2 in the morning and stands up to go to the bathroom. Because of those medications, their blood pressure dramatically drops from 124/78 down to a dangerously low 88/56 within seconds. Their brain is not getting enough blood flow. The room spins. They reach out for the wall but miss. Suddenly, we are no longer talking about simple numbers. We are talking about a fractured hip, emergency surgery, weeks in rehabilitation, and a terrible cascade of complications that often ends in a loss of independence. The research published recently should have made front-page headlines everywhere, but most doctors still have not seen it, and most patients certainly have not heard about it. That massive gap between scientific research and everyday medical practice is quietly costing lives. Here is the part that sounds counterintuitive. For decades, the medical mantra has been simple: lower blood pressure equals better health outcomes. For middle-aged adults in their 40s and 50s, that rule is true. Getting blood pressure strictly under control in midlife absolutely prevents heart attacks and strokes. The evidence for that younger age group is rock solid. But something fundamental completely changes in your body after age 75. The research clearly shows that seniors with systolic blood pressure between 130 and 145 actually live much longer than those forced below 120. They suffer fewer falls, fewer fractures, and fewer hospitalizations. The group that achieved that supposedly perfect 120/80 experienced far higher rates of severe dizziness, fainting, kidney injury, and higher overall mortality rates. Now, if you are someone who values understanding the why behind the numbers, what I am about to explain will give you a completely different framework. Your cardiovascular system at age 75 is not just an older version of your 45-year-old body. It is fundamentally different. 3 critical physiological changes happen as we age, and these changes demand entirely different blood pressure targets. First, let us talk about arterial stiffness. As you age, your arteries naturally become less elastic. Think of a brand new garden hose compared to one that has been sitting out in the sun for 20 years. That old hose is stiff and less flexible. Your arteries undergo a similar process called arteriosclerosis. When your heart pumps blood into these stiffer arteries, they cannot expand to absorb the pressure wave like young arteries do. Because of this, your body actually requires a slightly higher baseline pressure to ensure adequate blood flow reaches your brain and kidneys against gravity when you are standing. Second, your baroreceptor function declines. Baroreceptors are tiny sensors inside your blood vessels that constantly detect pressure changes. When a young person stands up quickly, these sensors detect the drop in milliseconds, signaling the brain to increase heart rate and constrict blood vessels to stabilize pressure. But as we grow older, these internal sensors become sluggish. If your baseline blood pressure is pushed down too low by medication and your sensors respond slowly, standing up causes that dangerous sudden drop in pressure known as orthostatic hypotension. Third, medication metabolism changes. Your kidneys and liver do not clear medications as efficiently at age 75 as they did decades earlier. A standard dose of medication that is perfectly appropriate for a middle-aged adult can easily be excessive for an older adult. The medicine lingers in your system longer, has stronger effects, and can push your blood pressure too low. From an educational perspective, understanding these three biological shifts is vital. It stops us from blindly chasing a universal medical number on a chart. Instead, it empowers us to see how our aging bodies operate differently. We must focus on treating the actual human physiology in front of us, rather than just treating a rigid set of numbers. Now that we understand exactly why our bodies change, let us look at the hard evidence from the recent research, because the specific details truly matter. The groundbreaking study published in the Journal of the American Medical Association Internal Medicine followed over 15,300 adults above the age of 75 for an average of 5 years. These were not hand-picked perfectly healthy individuals. These were real-world older adults managing everyday conditions like diabetes, prior strokes, heart disease, and varying levels of frailty. The researchers tracked their average blood pressure and carefully monitored what happened to them over those 5 years. They divided the participants into different groups based on their systolic blood pressure. One group maintained pressure below 120. Another group was between 120 and 130. Another between 130 and 140. Another between 140 and 150. And the last group was above 150. Here is the exact finding that needs to change medical practice today. The absolute lowest mortality rate was found in the group with a systolic pressure between 130 and 140. It was not below 120, and it was not the textbook perfect number. The group that was forced below 120 actually suffered a 28% increased risk of serious falls that required hospitalization. They experienced higher rates of acute kidney injury because their kidneys simply could not function properly with that lowered pressure. Most tragically, their overall mortality rate was 14% higher than those sitting comfortably in the 130 to 140 range. The research proved that pushing blood pressure extremely low is just as dangerous as leaving it extremely high. The true sweet spot for the longest survival and the best quality of life is moderately higher than what conventional guidelines recommend. Let us look at how this plays out in real life. Imagine a 76-year-old patient walking into a clinic for a routine checkup. Their blood pressure reads 142/84. The doctor looks concerned, references the standard guidelines, and says they need to get this down closer to 120. Medications are prescribed and adjusted over several months. Finally, the pressure sits at a textbook perfect 122/76. The doctor is completely thrilled, but then the patient notices something alarming. When they get up from their chair to answer the phone, they feel momentarily lightheaded. When they stand up from the dinner table, there is a split second where the room seems to tilt. They mention this dizziness to their doctor, who simply dismisses it as age-related and tells them to just stand up more gradually. But what is actually happening is terrifying. Their blood pressure looks magnificent sitting still, but the moment they stand up, it drops dramatically down to something like 95/60. Their brain experiences repeated episodes of inadequate blood flow, placing them at a massive risk for a catastrophic fall. This dangerous scenario is playing out thousands of times every single day across the country, and it is entirely preventable if we stop universally applying one rigid rule to everyone. I want you to go down to the comments right now and share your story. If you or a loved one have ever experienced a situation where a doctor pushed for lower numbers despite you feeling dizzy or fatigued, please comment below and let me know if you have ever felt worse after your blood pressure medication was increased. Your experience in the comments might just validate what someone else is going through right now. Here is what is absolutely shocking to me as an educator and a health professional. There is a simple test that takes about 3 minutes and can clearly identify whether your blood pressure medications are secretly putting you at a massive risk for falls. It is called an orthostatic vital sign measurement, and despite how crucial this is, most doctors simply are not doing it routinely during those short clinic visits. Because of this gap in our healthcare system, I am going to teach you exactly how to perform this test safely at home tonight. Having this knowledge is not just educational, it is potentially life-saving. Please remember that this is for educational purposes only, and you must share these results with your primary care physician before making any medical decisions. To do this, you just need a standard home blood pressure monitor, which you can find at almost any local pharmacy for about $30. Here is the exact clinical protocol made simple for you. First, lie down completely flat on your bed or your couch and just rest quietly for 5 full minutes. Let your body completely relax. After those 5 minutes are up, check your blood pressure while you are still lying down. Write down both the top number, which is your systolic, and the bottom number, your diastolic. Now comes the most important part. Stand up and immediately check your blood pressure again while standing. Do not wait around. Check it right away and write down those new numbers. Now, we compare them. If your top systolic number dropped by more than 20 points, or if your bottom diastolic number dropped by more than 10 points, you are experiencing orthostatic hypotension. This is a massive red flag. This physically proves that your blood pressure medications might be too strong for your aging body, or your target number is simply too low for your unique physiology. Let me give you a very specific educational example to make this crystal clear. Imagine your lying blood pressure is 125/78. It looks absolutely perfect on paper. But when you stand up, it crashes down to 98/64. That is a 27-point drop in your top number. That is highly dangerous because your brain is getting inadequate blood flow when you are upright, which is how you spend most of your waking hours. You might feel completely fine lying down or sitting, but when you are vertical, your body is operating on dangerously insufficient pressure. This empowers you to understand your physical changes better and gives you the exact data you need to advocate for yourself at your next doctor appointment. So now that you have this crucial data from your home test, the ultimate question remains: what should your blood pressure actually be? I am going to give you the exact ranges that the latest research suggests are associated with the absolute best outcomes for different age groups. Please understand these are educational guidelines, not absolute medical rules. Your individual target must always be determined in direct collaboration with your doctor based on your complete medical picture. Please never stop or adjust your medications without professional medical supervision. Let us break down the science by age group. For adults aged 65 to 74 who are generally healthy and active, the research suggests a systolic blood pressure range of 130 to 140 is highly reasonable. This specific range provides excellent cardiovascular protection while still maintaining adequate blood flow to your vital organs. For adults aged 75 to 84 who are relatively healthy, the evidence strongly supports a slightly higher systolic range of 135 to 145. Notice how this target is intentionally higher. This directly accounts for that increased arterial stiffness and the slower sensor responses we talked about earlier. Finally, for adults over 85 or for seniors who are frail regardless of their specific age, a systolic range of 140 to 150 may actually be the most appropriate. At this stage of life, preventing devastating falls and maintaining your daily quality of life absolutely takes priority over aggressively pushing blood pressure down to arbitrary numbers. Regarding your diastolic pressure, that bottom number, for older adults, it should generally stay above 65, ideally sitting somewhere between 70 and 85. If your diastolic number drops consistently below 60, that severely reduces blood flow to your heart muscle during its crucial relaxation phase. That is a major warning sign you must discuss with your doctor immediately. To understand how this works, let us look at a complex but common scenario. What happens when we have a patient who is 73 years old, manages type 2 diabetes, and has a history of a heart attack 5 years ago? Their current blood pressure is sitting at 148/86. Should they aim for the textbook 120/80? Probably not, as that invites the risk of fainting and falls. Should they just accept 150/90? Also probably not, due to their cardiovascular history. For someone in this specific situation, the research suggests a highly customized target around 130 to 135 might be their perfect sweet spot. It is low enough to protect their heart, but high enough to keep them safely on their feet. But here is the most important lesson. Your blood pressure is not a static number carved in stone. It constantly varies throughout the day. One single high reading in a stressful clinical setting does not mean your pressure is always that high. What truly matters is your average over time, which is exactly why diligent home monitoring is so incredibly valuable. If this extensive research exists, why hasn't your doctor mentioned it? Why aren't the official senior guidelines completely rewritten everywhere? The answer comes down to how painfully slow medical practice evolves. Most foundational blood pressure guidelines were built on massive clinical trials conducted decades ago, primarily focusing on middle-aged adults. When researchers concluded that 120/80 was the gold standard for a 50-year-old, the medical system simply applied that exact same rule broadly across every single age group. There was a dangerous assumption that what protects a middle-aged body must naturally protect an 80-year-old body. But over the past decade, researchers finally started looking exclusively at older populations, and they discovered the undeniable truth that one size absolutely does not fit all. Furthermore, there is a massive psychological barrier. For generations, doctors have been aggressively taught that lowering blood pressure unconditionally saves lives. It is incredibly hard to shift an entire industry from that rigid mindset to a nuanced, individualized approach, especially in a system where doctors are forced to rush through 15-minute appointments. To prove why treating the individual is so vital, let me show you how completely different two people of the exact same age can be. Imagine two patients who are both exactly 81 years old. Both of them have the exact same blood pressure reading today, 158/88. But their situations could not be more different. The first patient is managing mild heart failure, stage 3 chronic kidney disease, and severe osteoarthritis. If a doctor starts prescribing heavy medications to force their blood pressure below 130, the risks are astronomical. Those drugs could lower their pressure too much when standing, worsen their fragile kidney function, and cause severe dizziness. A fall for this patient would be catastrophic. A much safer approach would be a gentle medication dose. accepting a safer target of 140 to 145. Now look at the second 81-year-old patient. They are incredibly healthy, highly active, and play golf twice a week with zero significant medical problems. For this active senior, that same 158/88 reading might simply require some focused lifestyle changes to gently bring it down to 145/84, which is perfectly acceptable without ever touching a prescription pill. Same exact numbers, same exact age, completely different human beings. This is the ultimate definition of treating the patient, not treating the number. If this deep dive into the real science of aging and blood pressure has opened your eyes today and empowered you to take control of your health, please take a moment to hit the like button right now. It tells the algorithm that this life-saving information needs to be shared with more seniors. And make sure you subscribe to the channel so you never miss out on the honest, research-backed medical truths that can genuinely protect your independence. To ensure you can actually apply these medical truths and protect your independence, let me give you exactly 5 concrete action steps that you can implement starting tonight. This is how you take back control of your health. First, if you are over 70 years old and taking blood pressure medications, you must purchase a home monitor. Check your pressure at the same time each day for 2 full weeks, morning and evening, and keep a written log to find your true average. Second, perform the orthostatic test I described earlier. Lie down completely flat for 5 minutes, check your pressure, then stand up and check it immediately. If your top number drops by more than 20 points, or your bottom number drops by more than 10 points, write that down immediately. Third, assess your symptoms honestly. Are you experiencing unexplained fatigue, difficulty concentrating, or sudden dizziness when standing? These are massive warning signs that your numbers are simply too low. Fourth, schedule a dedicated appointment with your doctor to discuss your specific targets. Do not blindly accept a blanket statement that you must be at 120/80. Bring your home logs and standing test results. Fifth, if you experience medication side effects, speak up. Do not suffer in silence, assuming dizziness is just a normal part of aging. Medication doses can often be carefully adjusted to improve your daily life while still protecting your heart. Here is the ultimate lesson I want you to walk away with today. Your healthcare should never be a universally applied, one-size-fits-all approach. A 45-year-old and an 85-year-old simply cannot and should not be held to the exact same medical standards. We now have undeniable proof that for older adults, especially those over 75, maintaining a systolic blood pressure in the range of 130 to 145 is directly associated with the longest survival and the absolute best quality of life. Pushing those numbers lower than 120 dramatically increases your risk of devastating falls, kidney injury, and cognitive decline. The true sweet spot for your golden years is in the middle. You now understand exactly why your aging body needs these specific targets. You know about arterial stiffness, slower sensor responses, and how your vital organs process medication differently as you age. Most importantly, you are no longer just a passive recipient of medical advice. You are now an educated, informed participant in your own healthcare journey. You possess the exact language and the scientific knowledge to advocate for yourself. If this video gave you clarity, answered your questions, and gave you the confidence to speak up, then I have done my job. I want you to drop a comment right now using the word informed so I know you are ready to take charge. Please hit the like button, share this video with friends or family members over 65 who need this, and subscribe to the channel. In my next video, I will reveal the 3 natural supplements that actually support healthy blood pressure and 2 that are a complete waste of money. Please remember this video is for educational purposes only and is not medical advice. Never adjust your medications without consulting your doctor. Stay informed, and I will see you next time.